Hello, it's Dave with Rooke Products, and I'm going to do an in-service on the Rooke BKA stump protector. The BKA stump protector is for immediate post-op use, contracture control, and fall protection. We're now up to 29 reports of patients wearing this device, falling, and not one is dehisced. What you're able to do with this is to customize it to your patient's limb length and width. So when you lay the patient's limb in, you want the patella here in this opening, and the end of the residual limb here. If this end of the residual limb isn't resting comfortably, we've put in 2 spacers to help build that up to keep the patella right there. Now let's say that when you put the spacer in, if it moves the patella that way a little bit too much, we have on this end cap, there's 3 strips of Velcro which you can undo, take it down, resecure it to make sure that your patella is right there. Pull this flap over, and that's how we do the limb length. On the width of the patient, you'll notice on each of the flaps there's double stitch lines. We put in a pair of scissors for you. What we'd like you to do is to cut in between the double stitch lines, less likely that the material will fray. Now I've already cut this one. We'll pull this over. We don't want to fold it like I'm doing here in the demonstration. Folding it could create a pressure point on the patient, so we want to make sure that we cut it. The patella pad, it has a gentle sticker on it, doesn't need to be pulled down real hard. If you do, you could cause hyperextension to the patient's knee. So you're going to want to put it on the top of the patella, pull it down about a ½ inch on each side, secure it to the sides. What that does is, that's how we get the contracture control, because we have a hard backing on the device here. This is on top of their patella, gives them a little bit of wiggle room and they have that pain response, but it pushes them back into place. We've also added an extender, so if you run into a patient that has a really large thigh area, you can use the extender, and we can accommodate a pretty big limb. So when you have the patient wrapped up in this, you'll buckle them up. Doesn't need to be real tight, just buckle them up so it's snug. These straps are real long, you can cut them. I would cut them at an angle, that way it's less likely that they'll fray. We put in with each one of the devices a waist belt, so when your patient goes to physical therapy, they can keep the device on. What the waist belt does is it's universal, so this will slide to either side. When the device is on them, they'll tack it onto the Velcro on the side, and it'll keep it up while they're in physical therapy. The devices are washable, however, they're only washable in cold water temperatures and the coolest dryer setting. So if you do have the ability to put this in the washer, make sure it's all buckled up like I have here, take the spacer out, and it'll wash up real nicely. If you need to clean it up, you can clean it up with soapy water or alcohol, or if you need to, you can cut a breathable chuck and place it inside. Thank you very much for your time. I appreciate it. I look forward to seeing all of you real soon, and please stay safe. I've put my cell phone information and my email information on the bottom. So if you need to get a hold of me, either text me, call me, or send me an email. Thank you.